Mr. Tonko is recognized for 9 minutes.
Thank you. The Republican road to ruin budget, if enacted, will end Medicare. It will end a program that 46 million seniors and disabled individuals depend on for their health care. This gross injustice is made immeasurably more egregious and offensive by the fact that it is being done not to balance the budget, but to expand and permanently guarantee even bigger tax cuts for millionaires and billionaires, and to give new tax breaks to some of the world's most profitable companies. Rather than the path to prosperity, this budget is more like the road to riches, a road paved in gold with lavish handouts for special interests paid for and built with dollars from senior citizens who will see their hard-earned benefits rationed more and more with each passing year. I have heard a lot of talk in the last few months about the need to make tough choices in the budget. The average senior on Medicare earns just over $19,000 a year. About 1/4 of Medicare beneficiaries suffers from cognitive or mental impairment, and most have at least one or more chronic medical conditions. I asked my Republican colleagues, what exactly is it about stripping these Americans bare of their health and economic security that qualifies as tough? There's nothing tough about stealing from the poor and the weak to give to the rich. Our seniors, on the other hand, know all about tough choices. Do I buy groceries or do I buy prescriptions? Do I pay rent or do I pay medical bills? It hurts, but how much will it cost? These are tough choices. These are life and death choices. And with the passage of Medicare in 1965, we entered into a covenant with every American citizen. This budget breaks that promise and brings us back to square one. The Republican voucher plan ends Medicare. Instead, seniors will be on their own with a measly voucher and forced to buy insurance in the private market where all decisions will be profit-driven. More profits for insurance companies on the backs of seniors. Sounds like a Republican plan to me. This new voucher program amounts to a ration card. The value of the voucher is not linked to increases in health care costs in the private market. Yet the cost of private health insurance has risen over 5,000% since the creation of Medicare. 5,000%. The analysis of the nonpartisan Congressional Budget Office has estimated that in less than 20 years, the vouchers under the Ryan plan would pay just 32 cents on every dollar that a senior spends on health care. Now, the chairman has repeatedly stated that his budget gives seniors the same coverage as members of Congress. Well, as a member of Congress myself, I know that our health plans pay for about 72% of our health coverage, not 32%. According to CBO, the voucher program will provide a ration of $8,000 to seniors every year to purchase health care from private insurance companies. Yet the private insurance premium charged by Blue Cross in 2010 for a member of Congress was $9,012 and plus. Does anyone honestly believe 6 senior citizens and people with permanent disabilities will be able to find coverage from private insurance for $8,000 when they charge my friends here in this room $9,000? According to the Wall Street Journal, the average cost of health care for seniors over 65 in 2009 was $11,743. If an insurance company were to take on $11,743 of risk for $8,000, they would be out of business in short order. But Republicans don't believe their insurance company buddies will actually offer coverage for $8,000 or even for $11,743 just to break even. They know that seniors will have to dig into their own pockets for thousands of dollars as this plan hands Medicare over to private insurance companies to, yes, make even more profits. This budget takes trillions from seniors and rations their care. And where does it shift the savings? If you guessed permanent tax cuts for millionaires and billionaires and new tax breaks to corporations making billions, you guessed right. After more than a year of hurling lies and demagoguery about death panels and rationing care, Republicans on the panel before us today demand that we restrict seniors to a health care ration card and ensure that those who cannot afford coverage on their own will be left to suffer or die. They pay lip service to Americans' responsibility to share the burden and instead steal from those who cannot afford an expensive lobbyist and give to millionaires and billionaires and companies who can afford much, much more. I'm not playing politics here. I was educated as an engineer. I have a deep appreciation for numbers and calculations. I also know that our budget is a statement of priorities and values, not purely dollars and cents. I respectfully and honestly disagree with the values and priorities established in this road to ruin budget. It is for that reason that I am offering this pro-Medicare amendment today. This amendment expresses the sense of this House that quality health care programs for seniors Members of the military and their family veterans should be protected. My amendment states that these programs should be excluded from any legislation that would replace the quality care and health security they provide with vouchers, rations, or so-called premium supports. It also states that we should not be setting arbitrary caps on spending for these programs. In short, this amendment would ensure that Congress will not turn Medicare, TRICARE, or VA health benefits into a voucher system that rations care for our seniors, our troops, and our veterans. I would like now to yield the next 2 minutes to our ranker member, Representative Van Hollen.
Thank you.